Tell me when I'm ready to go. All right. Hello, everyone, and welcome to the Health and Safety Meeting for 2024. And I would just like to introduce some of my colleagues that are here today. And as the current chair for Health and Safety, I'm not sure if that's going to change or not, I would like to first introduce my colleague to the right. You can actually just unmute yourself, introduce yourself because you are new. Welcome to Health and Safety.
Oh, yes. Thank you for the welcome. And I am board member Kendra Mapp, and I'm excited to join the Committee of Health and Safety, given that my background is in mental health. So I'm just excited to be a member of the committee and looking forward to learning a lot.
And to my left, we have another board member who is not new to health and safety, but new for this year. I don't know if they heard you there.
Dr. Kareem Moffitt.
And then to my left again here at the end, we have our lovely chief. Dun-dun-dun, drum roll.
Hi, Chief of Staff, Dr. Little.
So thank you all for being here today. This meeting for today will probably not take the full hour, which I'm kind of excited about, but not really. But I think in order to start off, I do not have my agenda right in front of me, but I do know that the first thing that we will do is a nomination for the chair for health and safety this year. So I have chaired health and safety for the past 2 years, and now that we're moving into 2024, I'm going to look to my right and I'm going to look to my left to see if there are any nominations on the floor. We can have a quick discussion regarding if anyone would like to be chair for health and safety.
I would just like to ask the question of what are the responsibilities and roles of the chair for health and safety?
That's a great question, Board Member Mapp.
So to answer that question, I would say that the health and safety chair obviously runs the meeting for health and safety. They are in charge of making sure that we are meeting the work plan for the year. They are in charge of working with administration, which would be Dr. Little, in terms of making sure that our topics within our work plan are set and making sure that we have presenters, and the communication not only goes through with Dr. Little, but also our superintendent and then with our other colleagues that are on that committee. We then are responsible for making sure that those minutes are accurate according to our staff as well, and also presenting at a board meeting. So just like with our other committees, such as policy or whether it's budget, you have your chair, which serves as the representative for that committee.
Thank you for specifying the role.
Yes, you can make a motion. So as I'm currently trying to get my computer turned on, I am accepting nominations for anyone that might be interested in health and safety. I know that I stated before that I was the chair for the past 2 years, and I don't mind being the chair again. I just wanted to share the wealth with my colleagues and see if there is an interest, and if there's not an interest, then Board Member Weinberg will gladly accept to take it on again for the year of 2024. But I am now opening it up for nominations during this particular period of time.
Hopefully I'm doing this right, but I would like to make a motion to nominate Board Member Dr. Moffitt as the chair for the Health and Safety Committee.
Thank you for making that nomination. And so what we will do is Board Member Moffitt will have an opportunity to either accept the nomination, and then we will see if we have other in these other lovely seats, if there's anyone wanting to say something. But Board Member Moffitt, I'm going to let you go ahead. And we're very casual here also within this meeting. So I'm going to let you go ahead and say if you accept the nomination or if you have any questions or anything regarding that.
So I do accept the nomination. Thank you so much, Board Member Mapp. And it's very large shoes to fill from Board Member Weinberg, but I will, Vice President Weinberg, I'm sorry. So I'll definitely accept the nomination and hopefully can do a great job in carrying out the responsibilities of the Health and Safety Committee on the 12 areas that are listed on the work plan.
So, Dr. Moffitt, I would like to say that I really appreciate you accepting the nomination. And with this nomination, I think that I have to have a second. Is that correct? That I've accepted that nomination? Well, she's accepted the nomination. So we only have 3 people. So would I have to second that? I'm assuming. I second that motion, and I hope that Board Member Moffitt understands that I know that she's going to do an amazing job, and she doesn't have that big of shoes to fill, because I know that the work that we do regarding health and safety, I know that you're very passionate about it. And I do want to just sincerely thank you for stepping up. I know that you are always looking for, what's best for our students, what's best for our families, what's best for our staff, and just everyone also in the community. So I'm going to take this time now because I get to switch seats. Dun, dun, dun. We now have, and we will welcome, our new chairperson for Health and Safety is Dr. Kareem Moffitt, Board Member Moffitt.
Thank you. For the whole 2 people that are watching.
Yes, ma'am.
They get to.
So I would like to second the motion also for the nomination for Dr. Moffitt.
We have to vote, I think.
So I do have a quick question. You gave the name and then you also seconded. I love that. So we can do that. Is that okay? All right. I just wanted to make sure that we were all good. So we had she made the motion to nominate her. So that's why I seconded it. So yes, I think okay. Very good. So I was going to say, woo, it's different when you only have 3 people up on the stage. Plus, of course, our lovely Dr. Little. But yes. Say it again. All right. I need a vote. Thank you so much for that reminder. All in favor? Say aye.
Aye.
Aye. Extensions or anyone who does not think, please raise your hand. All right. Well, welcome, Dr. Moffitt.
Okay.
So I'm going to switch you seats. We're going to do a little quick switcheroo.
Okay. So while we're waiting on the formal agenda to come, let's talk about the meeting schedule right now. Last year, you all met quarterly. How did that work?
So I think,
I was looking at whoever map, like, how did that work?
and she's like, well, wait a minute, I don't know. So to answer that question, I think meeting quarterly, it did work for health and safety, although some things did sometimes come up, and it wasn't a problem for me as the chair to reach out to both our superintendent and Dr. Little with any concerns that came from either community members or additional board members. I do know that there was a talk of wanting to maybe have health and safety back to its regular schedule of being monthly. And I cannot remember, I'm going to look your direction. Why did we not have it every single month? I thought that there was a board discussion about it, and I cannot remember the exact reason on why we decided to go quarterly. And I do think that this might have occurred before you came on. So,
I remember there was discussion of disbanding health and safety, but these items are so significant, too significant to be placed into just the cow. And so we were going to try a cadence of quarterly just to see, but I don't think it was ever definitive. Honestly, I'm all for monthly or every other, particularly when we're talking about issues of student conduct and discipline, health, mental health, pedestrian safety. I think those are some pretty significant issues that the board could maintain some level of awareness on. So I'm fine either way. I do think quarterly is too far, but I'm open to discussing what a more significant cadence would be for you all. What do you think, Board Member Matt?
Just looking at the topics within the work plan, I know that some of these areas of focus can provide a depth of information. And so I do agree that quarterly can be a bit far out to have thorough discussion around this or thorough updates around this. So it might be most advantageous to meet monthly, just again, so that we can really give each respective topic, just to really make sure that we're paying attention to those respective areas.
Yes, ma'am.
and I can go either way. I do think for the past couple of years, I saw it when we did it monthly, then I also saw it when we did it quarterly. I could go either way. I don't have a strong opinion for either. I do think, and I'm not sure what Dr. Little may have to say, but in terms of some of the information and making sure that it is being, I guess, broken up once we look into the work plan and then deciding on if we aren't doing it quarterly and doing it monthly, just then making sure to hit those particular topics on that last page for the work plan on the back. And I know it can be done. That's what we did. And then we basically combined some of the topics together for it to be quarterly. So it is your will. And like I said, I don't have a strong opinion on either. I will support whichever decision.
I do have a question about the quarterly meetings. Did this provide an opportunity for administration to have significant time to carry out maybe what was discussed?
No, I think that when we had it monthly, they still had the same amount of time to make sure that they had things to present or they were adhering to the work plan or some of our concerns. I don't know if Little would like to comment on that.
Yeah, I would say for some of the topics, we wouldn't have updated data on a monthly cadence. Like if we think about student discipline as an example, we're looking at that on a quarterly basis, and that's the sort of easiest and best way to aggregate it and even talk about it with schools. Other topics certainly aren't necessarily data dependent, so that could be on a different cadence. I mean, we're here, at the pleasure of the committee and to help move the work forward. So timing is really up to y'all. If it's helpful to the committee, I mean, there is a middle option of every other month as well to sort of split it in half.
Yeah, my personal preference is to get some data, like you mentioned, more regularly. I think discipline data with regards, that's just kind of my sweet spot in that monthly. What infractions are we seeing? How are they going from the Promise Center back? That's the type of stuff that we could actually get more often. However, Mental Health Month might be an interest during that month, but maybe those are things that we see on a more continual basis. What are your thoughts? Monthly, I think we've got monthly, bi-monthly, quarterly on the table.
So I would like to ask Dr. Little kind of specifically, what are those areas where if you could go through that would generate that monthly data versus quarterly data?
Yeah, sure. Looking at on the list, so looking at those topics, we don't have standard reporting on child abuse prevention. But we do training around that. We have required annual training, in fact. So we could talk about work that's going on there, but there's not necessarily data to report.
Dr. Little, are you on page 1 or are you on the back of it?
I'm on page 1, sorry.
Okay, okay, we were on the back, so go ahead.
My apologies.
You said child abuse prevention was quarterly?
I'm
Is that what
saying,
you
like,
said?
we can talk about the work that we do as a district. We don't collect and aggregate data around
Okay.
child abuse prevention. For bullying, we have to provide a semester report to the board. That's something that is provided in written format to all board members, certainly something that we have discussed and could continue to discuss here. But right now, that's on a semester basis, so we're comparing a semester at a time of alleged bullying incidents, as well as how many of those have been confirmed, and can also talk about preventative work going on there. Sexual abuse, discrimination, harassment, and orientation. Those have been topics thus far that, again, we have programming going on related to. We have not reported out data related to either of those, in my knowledge. As Board Member Weinberg mentioned, I've been associated with the committee really for the last year, so of this past full duration. Prior to that, I can't speak to that. Resource coordinators and community learning centers, we collect a variety of data there, but right now that's really on a semester basis of where we're getting evaluative information. So where the school is sort of evaluating their lead agency, the lead agency in turn is evaluating their school, and we're doing work around that. Currently that cadence is at the semester. Student conduct and discipline, what we share with schools and what we look at as an admin team is at the quarter basis. So like end of quarter 1, end of semester 1, end of quarter 3, end of the year. And that's been similar data that I've shared with the committee throughout the last calendar year. Nutrition right now has an annual requirement, so we are responsible for sharing where we are with our nutrition standards in line with board policy. I think we did that probably in September. With the committee, health is a bit broad. We probably can define that more specifically as we go along in terms of what that means. Certainly, we've shared health of athletes, ways that we're trying to promote safety of athletes, particularly in contact sports, and can continue to do that. Mental health, just last month, we had MindPeace here to share about that. We are now on a quarterly basis getting access to more data from our mental health partners as well. That's been something the committee has asked for and we've wanted as well, and appreciate MindPeace for helping to pull that together. Pedestrian safety hasn't really been a database topic either. That's something that, again, we work with community partners in the city to promote, but don't necessarily have data to report out in that way. And I don't believe we talked about 11 and 12 in the last year.
Thank you. Thank you for that.
Yes,
I
thank you.
think that that's very, very helpful. I do know Board Member Weinberg will remember when we did these monthly, we were getting bully reports monthly, or was it quarterly? We were getting them regularly, and it was type of infractions, and we even had some questions about how was bullying determined. It was pretty regular.
And I do think so. And I was going to ask, Phyllis, are you able to pull up from a year ago when we did meet monthly, the topics that we did have and who maybe those presenters were? But yes, I do remember and recall, because we did have questions and we were seeking out additional information.
And I do think that I put some of these on here. Vice President Weinberg is meeting with the city and Councilmember Johnson around the, was it health, the health piece and drugs. And so I know we've got that partnership quarterly, that we're doing meetings quarterly. And so you may have some information to be presenting on health.
Could that fall into health?
Health, mental health,
Yeah.
pedestrian safety. I think what we need to probably do is sit down amongst the three of us and look at this work plan, look at the past work plan, and then decide on where we want to take the committee, if it's in the same direction or a different direction, and then things that we think are going to align with where we're planning on going in the future with regard to budget, with regard to things in totality, and then revise the work plan if needed, and then set a cadence from that.
And just to add something, so I think on your next agenda item, which would be the committee work plan, it would be actually done here. So we could discuss that and make a decision based off of here in the meeting.
Okay.
So Phyllis, I'm not sure if you're able to, if you can print off the work plan from 2020, what year was that? 2022?
Yeah, 2020.
And then at least if we have that here, then we can kind of knock that out because that would be the purpose of doing that here at this particular meeting. And then that would be the only agenda item that would be set so that you can move forward for your remainder meetings. To get that piece.
Well, I think we can get some discipline data from first semester. We can get some first semester data for sure, because we're now into second semester. So we should be able to get some semester reporting on some of the like bullying, whatever is resource coordinator, community learning centers. We can you say it again, Ron?
Oh, yeah.
Oh, okay. So we've got some work to do as a committee, and we will get that done. Ms. Phyllis, the next agenda item, well, we're just going to talk about the work plan, and then we'll decide on what should be at our next meeting. And are you all comfortable with the cadence of March, or do you want to meet every other
What
month?
did you decide on? Because I don't think I heard anything. I think I just heard
I think
monthly.
board member Matt
quarterly.
asked the question. What was your vote?
So the reason why I asked the question is because I wanted to see how the data aligned and how we could efficiently utilize our time.
Right.
And so if most of the data is being generated on a quarterly or semester basis, then having that information, it may be more beneficial to keep it at the quarterly cadence, because unless we want to just meet, you know, for the sake of having conversation around the certain topics, but to connect it to the data, then it may be utilizing our time wisely to have it on a quarterly basis based off of what Dr. Little has shared.
I personally think every other month. Having been there for every month, I think that's aggressive, but I think we had very good meetings when we had the monthly. And so I think it's also prudent to see the monthly work plan, the monthly schedule as well, because we may want to go back to that, or there may be some topics that have kind of gotten off of there. So we'll just decide.
Might I add something?
Yeah.
Okay. So in terms of meeting every other month, if we did decide to do that, I would be fine with that. And with the particular, if you're looking on the backside sheet, with these particular topics for the work plan, it would just be splitting them up to see what particular months were they done before, and then seeing how we can adjust them to, like you said, meeting the needs that we are actually able to get that data and that piece of information. Because it wouldn't make sense to say, okay, in February, we're going to talk about this topic, but they don't have the data. And so then they have to then come back and present to us at a later date. And so I would agree. I do think Ms. Phyllis did go grab, I think, the copy of the printed 1 year.
But that's for the monthly.
Yes, but when you look at the topics, so for example, mental health, sexual abuse, discrimination, harassment, violence, orientation, SROs, student conduct, these are all things that if, you know, we all agree on that, Dr. Moffitt, in terms of for these particular topics, which I think we should because it still sticks within the realm of health and safety, it would just be now to you to suggest in January what 3 topics or what 2 topics. Or, excuse me, February, because this would be the January meeting. And then if we did February, would you then think we would do February, April, I'm doing every other month, June, and so forth? Or would you like to do it every month?
I don't know. I kind of want to look at the other topics to make
So
sure
it's
that they align-
exactly
they
the
align there.
same.
Okay.
It's just that it would be, they were dispersed for the 12-month calendar year instead of the 4-month. So yep, they're exactly the same.
You know, honestly, I think that I don't want just a reporting of what SROs do. I want to see what are the SROs collecting. So I don't know exactly what was reported out for sexual abuse and discrimination, harassment, but like what was reported out there. I don't want just a presentation on what the district does. I want to know what is our district doing have we had any reports of those things from students? So I don't know exactly what these topics
Right.
entail.
And so the topics entail what you would like them to entail as the chair. So what I did for those particular topics, we did ask for some data regarding some of the information, and then we asked for presentations that applied to the district and how it affected our students or how it affected staff, and they were able to report back. But that if that is something, for example, when I had the SROs come in or we were talking about that, if you wanted more additional data, then that's what you would just discuss with your liaison to say, hey, can you make sure in your presentation that you have this to present to the committee?
Another question is for mental health, why did we have that in January? Was there any particular reason? Because mental health month,
Right.
Youth Mental Health Month is in March.
I know, and
Why do we have that?
I brought that up as well, and I think it was because when we changed to the meeting quarterly, we had to then move it. But I am all for keeping mental health exactly where it should stay within the particular month. So if that is something, then again, this time frame is all open. It does not have to be in that particular month.
Okay,
Thank you.
okay.
And like if you see on this last page here, it was listed from January all the way to December and then the topics. So I think mental health was actually in August and mental health is in May, I thought. Is mental health month actually May?
Mm-hmm.
Yes, so I would be open to having that in May or even a little bit before so that the district can be prepared to start doing things for that in May and not having the meeting after the fact, kind of, you know?
Yeah, if you look at this particular calendar and see, like in January, we got a discipline report. In March, we got a discipline report. May, we got a so I mean, that was a regular cadence that we had that I really think was extremely useful. Of course, this had COVID-19 pandemic, but I see value in having meetings that have relevant content that are not jam-packed with things that we're trying to get through them and check them off versus having time to discuss. So did you find that the meetings when you had them every quarter were jam-packed or were they?
I'm going to speak from my experience. I do not think they were jam-packed. I'm also going to actually let you say I thought that they were very efficiently done, very well done in the fact that we were able to get whatever information that we needed and any of my colleagues were able to ask any questions that they needed as well.
Yeah, it's simple concurrence there. I think it was robust discussion and digging into all of these topics in a meaty way, but also able to get that done roughly in an hour every quarter.
What was your vote for a meeting cadence?
Yeah. Oh, remember I said it doesn't matter to me. So I'm open to, I can see benefits of both. I would be open to the monthly. I would be open to the every other month. I would be open to quarterly. It's just about, you know, what we would decide and in terms of making sure that we have the information available.
I guess for me, too, so not only trying to align it with the data, but these are very broad topics, right, on the work plan. So I guess my question is how, or what is the plan to dig into these topics a little bit more specifically so that we at least know what we're covering? So I'm seeing a high overarching view of what the work plan is, but I guess how to specify in greater detail what we're going to focus on in each, for each month with each topic.
Yeah.
I would also just suggest possibly looking back at the minutes for the other meetings for this particular year and even the year before. So it kind of will show some of the information that we did present on and how deep we got or how maybe not deep. And then maybe seeing if moving forward, since you are now on this committee, if there are additional information that you would like to dig into.
What we did the year that I was on health and safety is, were you chairing it then? I thought you were.
I feel like I don't know.
The committee chair would send out to the committee members any question. Do you have any questions? These are our topics. Do you have any questions? And then we would send that to the staff, or to the superintendents and the staff around what we're looking for in that topic. So I'm not exactly certain if that's how it was last time, but that's
still went that way.
generally speaking how it goes, is that you have a topic what is it that you would like to see so that you can better govern? For me,
Mhm.
I always look at discipline data because it impacts all of our goals. So I want to know how many students have been requested to be removed, and I like that information regularly, but totally is fine. So it's just whatever the topic would be,
Mhm.
we'll send it out. I'll send you something to say, hey, remember, Matt, do you have any questions around SROs? What do you want to see? I'll collect that and then we'll send it to Dr. Little for him to research and present.
Okay. Okay, thank you.
Yes, ma'am.
And just to add, so like, for example, when we discuss pedestrian safety, I know this was during our first year where we got a lot of emails and complaints about children in crossing or not being able to see signs and things outside of the schools. So that was like something that we were able to say, hey, can we get some more additional information? What are your plans, or what do you plan on doing to help, adhere or make this particular problem better? So yes.
And in all honesty, you could get a lot of concerns because you are on health and safety of parents and neighbors that have health and safety topic issues and are wanting that information. So you could bring it up and say, hey, I got a question about this. Can we discuss it? So that they could see it, the answer to the question. That's how I've done it in the past as well. One prime example is Fairview. They wanted a study. The Fairview families wanted a study right in front of that school. Clifton, the city was only going to pay for their study to go to Ludlow. They wanted it to be extended. So we contacted the city and then got a presentation. They came to budget. They came to health and safety around the concerns that they had about that. And then we had the staff do some research at that time around it. So you can use it however you need it.
Okay, thank you. Dr. Little, you said the sweet spot is, what did you say? Every month and a half? Is that
Every
what
other
you-
month.
Every other, yeah.
I don't know that I said there was a sweet spot. I do think, I do think looking at the monthly cadence, there were data points like, bullying and discipline, which were still delineated as quarterly updates. That's the only thing I would emphasize. Definitely want to make sure that we provide the data needed for the committee to do the work, but want to make sure that data is available and that it is comparable to prior time periods as well.
Mhm. Okay,
So let's land on every other month.
yeah.
Let's plan one for
In the
February.
middle.
Yeah,
Yeah.
it's a good little meeting in the middle. And if we find that we need to have more frequency, we can always change it. If we find that we need to have less frequency, we can always change it. It's nothing set in stone. So the next meeting, let's make the next meeting for February. Or do you need time?
Just need clarity on the topic.
Mhm.
Get
So I have a
that to me.
question for you. So if you're going to go with February, you said every other month.
Well,
So if we did February, would you then, the next one would be April,
April.
June?
So hold on. I would just want to align around a quarter. So the end of the quarter is March. Is it March? Correct.
It is March, and the cadence that Board Member Weinberg is laying out is actually helpful because the quarter ends in March. That would allow us to
Right.
aggregate data and report it to you in
Correct.
April.
Right.
So that's what I was just thinking. I wanted to align there. So February, April,
June,
June,
August,
October,
and then
and
December,
December.
which would be your planning meeting. So that actually could work.
Mhm.
And Chair Moffett, may I ask another question?
Sure.
So as you also are doing your work plan, just also deciding if you want to ask your colleagues in terms of keeping the meeting date for the Monday of the board meeting and then the time frame.
The next question. Does this work? The second board meeting of the month prior to the meeting. Does that work for you? Remember that? This time?
If possible, I would like to change the meeting dates. I know that yes, we'll be here for like the business meeting, but if we could find another day to meet, that would probably be helpful for my schedule.
Suggestion?
A Wednesday?
Early during the day
Uh,
or later during the day? What's your preference? Time, does time work or?
So if we did stick with the Monday, earlier in the day is fine. Probably at least around like 10 o'clock, just trying to make sure that 10, 11, somewhere around there, I'm trying to navigate, my schedule with little ones.
Board member, Vice President Weinberg?
Yes, so I would love to stick with the time of Monday right before the board meeting, just due to scheduling. And I also know that in health and safety and Chair Moffitt, when you were on, we had the discussion of not having it in the morning time for individuals to be able to either log into Access or whether it's for presentations. I would be open, but I do know that that will not work for my particular work schedule.
Is there a particular preference of staff?
My only preference would be if we're choosing first or second board meeting to keep it aligned with the second one, again, just to make sure we've got the time we need to analyze and aggregate reports for you.
That's a tough one. 3 people on.
I know.
I'm fine. I don't like the middle of the day. That's just me because it's kind of like you're doing something, and oh, dang, I got a meeting, and then you got to go. But I understand.
If we need to stick with Monday, we can definitely continue on the Monday cycle, and I can just make accommodations. I can make adjustments.
So before the board meeting is good?
Mm-hmm.
3?
Mm-hmm.
Okay. Okay.
Do appreciate that.
Mm-hmm. You're welcome.
And so we're going to say Mondays before the second board meeting. (3 p.m.) Okay, Ms. Phyllis, do you have that? February, April, June, August, October, and December. The second board meetings of the month at 3 p.m. on a Monday. You want to do that now? Okay, so I'm being advised that we need to decide on our topics for the month. Let's see. Do you all want what? Let's for sure do February, and so that staff has an opportunity to see what they need to be working on, and then if we need to take some time, and you all need to look at what other topics need to go where, we can do that for February. Board Member Mapp, what would you like to see for February? Would you like to keep it with pedestrian safety? We don't have anything, we haven't done bullying, a discipline report. I'd like to see a discipline report for February from the first semester. Will you all have a bullying report? Okay. Anything else?
Give me 1 second as I make the comparison between the two plans.
So to make sure that I heard correctly, you were saying for February, leaving it at getting the first semester discipline and then also bullying as a
Correct.
topic. So having those two. And I know if I look at what we did last year, we did the mental health piece, but we can obviously move that. And we did SROs, which I don't think SROs needed to go at that particular month. I think I just put it in because I think there were some questions regarding it. And I see when we did it yearly, we had COVID-19, but obviously that.
Remember, Matt?
Okay, so just for clarification, so for December, there was a topic about mental health, right, with MindPeace? Okay. So would it be best to move the sexual abuse and discrimination down to February, or are we planning on having those conversations anytime soon?
I would say it would be whatever you would all like. And just keep in mind, remember when we had that mind piece in December, that would have been for last year. So now moving forward for the new year, it would be wherever you would like to put it.
So for February, we should get, according to the outline, we should definitely see some information on discipline, code of conduct, and bullying. I'm not exactly sure. Again, I just don't want people to come in here to present just to present.
Right.
I don't need that. If Mind Piece is going to come in and talk about data that they've collected, that's what I want to see. I don't want to just hear a presentation from Mind Piece. I want to hear what they have seen, areas of concern, where they need assistance, so that we know how we can make some meaningful changes or adjustments to either policy or programming and to be more effective. I'm not interested in just having SROs come to tell us what SROs do. I've seen that. We can look at a recording. I think that we need to hear what it is that they're seeing in our schools, so that we can actually impact some change. Or what are they seeing around discipline? What are they seeing around the community to bring the community into the schools? So again, I think everything from first semester should be applicable to be reported upon in February. But it's about when we say mental health, I don't want to hear just them to come in here. Tell me, I would like mental health. What did they see from the first semester? So I'm happy to put mental health in there if you all want that, if you think that. But again, I am not interested in just a presentation for a presentation.
So the mental health presentation from December actually was very helpful. She provided some additional data in terms of moving forward for our students. So I'm not sure if we need to have that again for January. I think it would be better to have it later on in the year to see from the December meeting and the information that she did give, what's a follow-up to that in terms of those numbers.
Yeah.
And I would suggest that for February, adding in, if you did want to add in SROs or pedestrian safety, let's actually have a specific topic, like you said, in regards to the SROs. What are they seeing? How is the data in terms of behaviors or infractions? So just deciding, do you want to have SROs in February, or do you want to do that in April? It's just trying to make sure that we kind of split these topics up, whether there's 15 total topics, and then we have 6 months to get through those particular topics.
And for me, it's also an issue of timing. So I don't want to talk about pedestrian safety in February when, once it gets warmer, our kids are out of the building and we have more infractions with regard to safety. So I would rather talk about it in the context of the season rather than just to have it as a check-in item.
And I think that's great too.
So what we definitively have is bullying, student conduct, discipline data, and
Bullying.
that was it, right?
Yep, discipline. I think you had the discipline data and then the bullying.
Bullying and student code of conduct. So those are the three for February.
So I have two. So discipline, the student conduct discipline data, that's just one. That's one topic. And then bullying is your second topic.
Correct.
Was there a third?
We didn't get to there yet, because I think you were wanting mental health, but not really.
No. It wasn't that I was wanting mental health. I was trying to, that's why I asked the question about, there was a presentation in December, so it wouldn't necessarily need to be at the top of, repeated as soon. I'm just trying to make sure that we are still covering the topics that were outlined on the work plan, and just seeing how it can connect within our meeting schedule ultimately. So it's not necessarily that I have a preference, and when I see fit, I'll definitely make recommendations about what topics I think should go where. But I am okay with bullying and student conduct and discipline. And you may add the SROs on there. It can align with the discipline data and conduct.
It can. Yeah. The other thing that you brought up with the city that I think is very relevant, and I don't know if you would have any data right now, is regarding medical emergencies. Trying to find a way to say it.
Right, and that
where did you have that? in the past?
So I did not have it in the past, and that was something that I definitely think needs to be included, and we can maybe put that into the health portion where
Okay.
it says health. It could go into in-school safe. Well, no, that's a little different. In-school safety and lockdown. I mean, it could still even go into student conduct and discipline because those infractions are supposed to be, reported as well. It could go into safety and nutrition, physical health.
Did you want it
It's
for
wherever.
February? Well, I think what I want to do right now, in the best interest of time, is solidify February, and then we can collectively get together to solidify the rest of the year.
So I do think it would go with the SROs for February. And I do think that in terms of saying that you want to kind of hash out the other ones, I think that we have to do it in the meeting though. Fortunately, I think it has to be done.
I don't know.
I thought.
Because we've done our work plan for other, do we have to do the entire work plan in the meeting, or can we do that via email?
Clarification.
Right, we just can't discuss them.
Right, that's
But-
what I was saying. I didn't know if we should. But, and then finalize it through.
Well, I don't think that we are going to have a lot of time to finish that. But I do, and I would prefer if we could maybe solidify February and then everyone have a moment to sit with it and look at it, because we haven't seen it. This is the first time I've seen this. So I would like to put a little bit more context to some of these topic areas, and I can't do that in 13 minutes.
Can I make a suggestion? Even though I know if you don't have time to do it, just to give you a heads up. So we have the months listed, and as I'm looking at the particular topics, for example, you said that you wanted discipline when? Every what?
The discipline is quarterly.
Okay, so if we're doing discipline in February, Dr. Little, when would discipline need to be done again?
We would
Based
be
off of the
able-
months of February, April, June, August, October, and December.
Yeah, we would be able to do it in April for quarter 3, either June or August for the full year, and then December for the first quarter.
So that would be perfect to just go ahead and put discipline down for February, April, June, and then what was it, December?
December.
And then what was mental health is the month of May, right?
Okay, yes. Again, this is going to be a skeleton.
Right,
Because
exactly.
I really,
Exactly.
there could be other things I think that
Right.
significantly impact that. Again, I would like to look at safety in context of the seasons. We know that as it gets warmer, our kids are out and about more. So I think pedestrian safety is more applicable to talk about in terms of maybe June,
That would be great.
and maybe December. But again, that might go with safety in the communities in which school
Mhm.
facilities reside. I don't exactly know. So I'm going to,
And I know that you're saying that it's just a rough skeleton, and that's also good to have. And I'm just trying to see, what topics we could just see when we would want to report them based on the data that's available. And then also, like you said,
Sure.
if the month, reflects that. So for example, menstrual health, I mean, that can go in any particular month. Unless there's a specific, I don't think there's a menstrual health national month.
well, it also should align with legislation that is applicable as well, because we've got some legislation that's pending. Didn't we have
It
growth
passed
health?
already. Yeah. they
No,
already-
like growth health period. We got the sample in the office from the people. because
Yes,
the,
but with the bill that has already passed, they have what do you call them?
Dispensers.
Yes, the dispensers too in every school. So just, getting an update regarding that piece. So that has been passed and taken care of, and they're spending the funds on that as well.
So that would just be an update, right?
That would be an update. Or if there are additional concerns that we feel that still need to be addressed regarding that particular, topic. But I get what you're saying in terms of looking over this and then sending it out. I was just trying to make sure that we did get at least something put out there, so at least we had an idea.
I got you.
I do have a question. So in terms of the mental health reporting, is all of that information coming directly from MindPeace in terms of the data that we receive?
Most of it is coming from MindPeace. There could be some additional things that we collect directly in the district, but by and large, it's coming from our mental health providers through MindPeace.
Okay, because as we're talking about having those regular conversations around student conduct and discipline, we know that mental health directly correlates with that. And so I think to try to have the conversation in its entirety, are we able to have those regular mental health quarterly or have those regular reports as well, or close to having those reports the same way as discipline?
Board Member Map, I would say close to. This is actually the first school year where we're getting the type of data from MindPeace that we're now collecting. So I can't promise because we don't have history there, but that's exactly what we're working towards.
Okay.
Vice President Melinda.
And also, as chair, if there's a particular group or organization regarding mental health that you would like to bring in as well, that would be your option as well. You would get to decide that.
So are you suggesting mental health at the February meeting, or did you want that? When did you want to put that in?
So I would want to have it as a similar cadence in terms of like reporting of data. If we're focusing on student discipline, that mental health directly aligns with that information, so we could be able to make inferences or draw more conclusions based off of those two data points.
When would you like to see it? February or
April, June, and December.
Yes.
well, we had it
Whatever
aligned
the
with
cadence is for discipline.
Mhm.
Okay,
Reporting.
so we got that. I said February, June, December. Did you have something different?
You have it February, April, June, and December.
Discipline, right?
Yeah,
Okay.
discipline, and then she's saying to then add that mental health piece to that as well,
Mhm.
since it, I guess, goes hand in hand.
I'm going to read this back to you, Ms. Phyllis. It's not your fault. I got you. I could feel the tension.
Hopefully you're being patient with me.
Gosh. Okay. With regard to your work in collaboration with the city, where does that fall in?
Are you talking to me?
Yes, ma'am.
Oh,
I'm calling it a committee, but it was yourself and council member Johnson
yes.
were forming like a de facto committee.
I'm not exactly sure. I think you had asked before, and I mentioned that we could include it in with health. I'm open to whatever. I haven't had an opportunity to speak with council member yet, but in terms of whenever we do start the work, it could be something that could be reported on anytime.
So currently health is in September. Would you like me to put it on the schedule in August or October? I was not going to do this, but since you're wanting to put these down, let's go. August or or October. We don't have anything for either.
We could put it into August. And we're titling it health, safety, or health. It was health, I think.
I'm going to say health/safety.
Yep, that works.
Okay. We don't currently have anything right now for October.
Right.
We do have under this quarterly schedule athletics, extracurriculars, physical and mental safety, pedestrian safety, menstrual health, gun safety. Again, other than it being listed as a topic, what were the discussion points? I'm not interested in just presentation on this is what's available. What are we doing with those?
Right, and right now I can't recall because like I said, it's in the minutes, but it wasn't just a presentation. Or if it was a presentation, it was, anything that the committee thought that they needed clarification on, and then we had additional questions. But again, you can review the minutes from last year for the particular topics to kind of see or get an example of where we went moving forward.
So I'm going to list, because I don't have time for that, honestly, but we're gonna move it. August, let's list athletics and extracurriculars.
And then I guess if you're listening there in August, if we had something particular, in mind regarding that. then that would, obviously, we would give that to you to then make sure that they
Sure.
have that information.
Sure.
So you said August, what was it?
I have health, safety,
Right. Mhm.
athletics, extracurriculars.
Athletic. Okay.
I mean, we have like physical, mental safety. Again, I kind
Yeah,
of
that
think
all
that's a
goes
little
together.
redundant. Menstrual health and gun safety. So I'm going to put that here. Menstrual health and gun safety.
I do think safety is in June
Okay.
month. So do you want to keep that in terms of?
It's currently in
June?
September. Do you want to make it June?
Yes, I think I kept it in September based off of how the meeting cadence worked before, but.
So June?
Mhm.
Okay, and safety and the nutrition, physical health, vision, dental, community, child abuse. What was that about the community learning centers?
Yes, and it was the different amount of students that were treated for vision and dental and any issues or things that they saw that may have came up.
Okay.
And Child Abuse Month is, I don't remember what month that was, because I remember in our last talk, we wanted to do something on the website to promote, being educated about that.
You have it under June currently. Community learning centers, I'm kind of torn. We don't have anything currently for October,
April? Okay.
but I'm a little nervous about putting it in June.
Board Member Muffet, I think we did have discipline code of conduct in October.
Okay. Instead of December?
It is December. That'll let us report on the first quarter in December, sorry.
Okay. We don't have anything for October. So we can talk about community learning centers, I guess, from the first quarter data, maybe in October. I'm open. Okay, so I'm going to put that here. I'm going to put community learning centers.
And what was the month that
definitely-
you said you put it in?
I put it in October because we don't have anything
Because we don't
there.
have anything. Community learning.
Sexual abuse, sexual discrimination, sexual harassment prevention is listed under the previous monthly calendar for October. Would you all like to keep that?
I think that would be fine.
I'm going to put that here. Again, Ms. Phyllis, I fully anticipate that these may shift a little bit. November was, well, you had no in-school safety. That was on a
Those were
monthly.
the lockdowns and just
Okay.
giving updates to students because there were some complaints about the schools making sure that students were aware of following up after lockdowns and how they were feeling and things like that.
Okay, so
And it
let's put
just-
that in December
December?
because that ties to mental health. So maybe there's some correlation. I don't know. You're the professional.
Now, I know there is a particular date in which these are to be done for the school year. Do you recall that? For the in-school safety and lockdown, and I think that's why we put it in that particular month, but
We have deadlines throughout the year, committee members, so really we could provide an update at any point in the year just
Okay.
based on where we are at that point in the year.
so you said put that for December.
Yes. Let's say in-school lockdown.
You already list athletics and extracurricular yet?
I did in August.
Yes, in August.
Okay, yep, I see that. And then you listed the physical and mental health, right? Or no? I don't see that one.
Where is that?
It's
Currently.
underneath in September where it says athletics, extracurriculars, physical and mental safety, and then with the pedestrian.
So I didn't take that out because I thought mental health would be with the quarterly, but do
Mhm.
you want to see that separately? Physical and mental safety, what is that?
Well, what
how
is
that
yeah,
different?
I think it was the physical in terms of student athletes and what was it?
It was a bit of a combined report, but we were looking at heat-related
Yes.
protections,
And then,
as well as the guardian caps, what we're doing in contact sports to
Yes.
limit head injuries.
head injury.
So I'm going to keep that with all athletics because I
Athletics,
think
yeah.
that's very applicable.
Yeah.
I'm interested also in like transportation around athletics. Are we getting our students to do these games
Mhm.
on time? So
That would be with the athletics and the extracurriculars, I think. So you said you're putting the physical and the physical part with the athletics and extracurriculars. Correct, okay.
Mhm.
And did you put pedestrian safety anywhere? Because I think that's the only other one topic we did not hit.
in June,
June.
June? Okay. With gun safety.
yes.
Okay. And I think based off of what you just listed, I think that is everything. And of course, like you said, it's a skeleton to then go back and see if that makes sense.
I think it's definitely a start, and we're only 1 minute over. And there are some other things that, I'm happy to send some questions, and once we get this together and actually look at it, then you all can add or subtract or maybe make a little bit more detail around. So this is definitely a great start.
Yeah.
And then in your December, you would want to put your planning to make sure you have
I
the
think
planning meeting. Yep.
Phyllis,
So I do want to add, if possible, under the safety and nutrition, conversation around like our vendors that are coming in that's offering food or anything of the sort to our students to make sure that there's necessary procedures and protocols in place to ensure their overall wellness. I think that's an important area of focus.
where would you like to see that?
Where do we have the nutrition piece?
Yeah,
was in
I think that's the
March.
piece we did. Oh, it was in March?
It's in
On the
March.
on the
Oh, yeah.
monthly calendar, it was
I
in March.
realized I don't think we have.
And I'm going to say, actually, we used to have the nutrition department bring us food that they serve the kids. But there is a really big discrepancy between what the kids get
Mhm.
and what we get as a board. So we're going to put nutrition on here in maybe in April. Is that
Yeah,
good?
because I think
Yeah,
you only
that's
have one topic in April, correct?
We have discipline and mental health.
Okay. No, I missed that one.
But we actually used to get a very comprehensive report around nutrition. What was the FDA requirements? What did we receive? I guess USDA requirements. What did we receive? How did we figure out what to serve students? Nutritional content, all of that. We looked at vendors, providers, and then they would bring us samples of what they served and what was in the vending machines. It was a very, very good comprehensive report from our award-winning nutrition department. So I think we got this. For the 5 people that are watching, we've got our next meeting will be in February. We have landed on a cadence of the Mondays of the second board meeting of the month at 3:00. And we are going to be meeting every other month. Our next meeting will be in February, and then we will go into a cadence of April, June, August, October, and December. We will, Ms. Phyllis, I don't know if you want me to go through the whole list. I'll just do February. February, we've got discipline, which will be reported quarterly, student conduct, bullying, SROs, and resource coordination. We will send out a question to each committee member. Are there any specific questions, any presentations that you all would like to see? And then we'll compile that and get that to Dr. Little, preferably if you wouldn't mind, and I'm speaking to myself, so that we give them as much time as possible responding to that within a few days so that we can get that list to them and then they can begin working on it. I'm guilty. Sometimes I don't check my emails for days, but at least like we can give them as much lead time as possible. It is 4:04. Is there anything else that the committee members have? Vice President Weinberg?
No, I think that this is a good start. So it gives us an opportunity to just be able to visually look at this and see, and then to go back and kind of add anything else that we think that might be needed. So I think that this is good.
Dr. Little? Okay. We will be adjourned at 4:05. Talk to you soon. Our board meeting starts at 5:30. See you later. Again.